All right, welcome everyone. Like I said earlier, my name is John Pramani and I'm going to be helping facilitate tonight's meeting. This is a meeting, and I apologize if you can hear the barking dog that's outside of my window. This meeting is for the Belcourt Hill HOA on the former Ford Aeronautics facility. It's being hosted tonight by the Santa Ana Regional Water Quality Control Board. And we're going to be discussing the results of the human health risk assessment for your community, as well as the results of the recent soil vapor extraction pilot test, next steps for the project, and take time to answer your questions. So just a few ground rules before we get started. As you probably heard, this meeting is being recorded for folks who cannot make it tonight. We'll have that posted on the GeoTracker and Ford websites tomorrow. And this is a Zoom meeting, so we can see all you guys and you can interact with us. We'll be stopping at key points throughout the presentation for questions and also save time at the end. And you can voice your questions by either raising your hand on your camera and we'll call on you. You can use the raise your hand function on Zoom. If you're on the phone, to do that, you press *9 and then press *6 to unmute once it's your turn. You can also submit questions via the chat function and we'll read those aloud. We do ask that if you have property specific questions, so say questions about the results of some sampling at your home, that you put your name, phone number, and address into the chat function, and we'll have a representative from the team follow up with you directly. As you can see in the last part of that slide, you're also welcome, if you have questions at a later date, to contact Jessica Law, the water board case manager, and her phone number and email are on the slide. And you can also contact the Ford project information line, and that phone number is there as well. And my colleague, Sarah Craig, will add that into the chat as well. So I mentioned before, the purpose of tonight's meeting is to discuss the findings from the March 2021 human health risk assessment for your community, as well as the SVE pilot test. You'll see that there's a list of handouts there. Those are available on Ford's website, and that website link is in the chat now. Before we begin, I want to just take a moment to introduce the members of the team we have with us who'll be presenting. So first we have Jessica Law, the case manager from the the water board. We also have Amanda Palumbo, a toxicologist with the Office of Environmental Health Hazard Assessment, who reviewed the human health risk assessment. And then we have some members from Wood Environment and Infrastructure, the technical consultant working on this project on behalf of Ford. So we have Mike Barnes, the project manager. We have Daniela Haman-Nazaroff, who is the engineer on record. And then we also have Jane Parkin-Coleman, who helped prepare the risk assessment and will be giving the first part of the presentation. Here's the agenda. As I mentioned earlier, we'll have time in between each presenter's section to pause and answer your questions. And then we'll also save some time at the end to answer questions. And with that, I'll go ahead and turn it over to Jane.
Hi, everybody, and thank you to John for that introduction. Good evening to all residents and representatives of Belcourt Hill. I will be talking about the human health risk assessment for this area. The risk assessment is an important document, and Wood has a large team of scientists that are specifically trained to prepare risk assessments, and that is what we focus on. So as John mentioned, my name is Jane Parkin-Coleman. I've been conducting risk assessments for about 15 years, and you may have seen my colleagues Karen or Usha at other meetings, and they and I are part of a team that has prepared the risk assessments for the Ford Aeronautics site. Just to introduce some context, a risk assessment is all about the chance of an event occurring. So this is about chances and doesn't represent certainty. Perception of these risks or chances is about choices and behavior, and those vary by individual. So when we conduct a risk assessment, it is to help people inform their choices. We do make some risk management recommendations in risk assessment, but risk management is ultimately the water board's role, and it's part of what they do. Oh, next slide, please. The 4 key components of a standard risk assessment have been presented at the community-wide meeting, but we know that many of you may not have been at that meeting, so we just wanted to introduce these concepts again. Wood has done all of these steps in the risk assessment, And that whole process is what we are reporting on tonight. The 4 steps are shown here. The first step is data collection and evaluation, and this includes deciding which contaminants we are going to look for, and then determining where they are and how much of them are in the environment. So specifically for the risk assessment for this site, we have collected samples of indoor air and soil gas. It's important to note that the more data that we have to put into this process, the more confidence we have in the results. So the data used in the risk assessment have been collected over about 2 years. So that is what we have in that first step. And then the second step is exposure assessment. And this answers the questions of who, what, when, where, and how much for the risk assessment. So the process of evaluating exposure is designed on purpose by regulatory agencies to be protective of human health. For example, one of the assumptions that we make about exposure is that a resident is present in their home for 24 hours a day, 350 days per year, and that they live in the property for 26 years. So that's exposure assessment. The next step is toxicity assessment, and that specifically refers to the numeric criteria that are used to evaluate how toxic a chemical is. So there are toxicity criteria that are related to both cancer and non-cancer effects. Only some chemicals are considered to potentially cause cancer, so only those have cancer toxicity values. All of this information put together, the chemical data, the exposure assessment, and the toxicity values, is used to do the risk calculations. And that's where we estimate both hazard, which is the non-cancer component, and the cancer risk, and that is for each specific residence. Next slide, please. So Jessica also presented this slide on risk management at a community-wide meeting. And the main message of this slide is that we get a lot of numbers out of the risk assessment, and some of them are related to the chance of cancer or cancer risk, and some of them are based on non-cancer hazard, which are the other health effects not related to cancer. So based on the ranges of those numbers, which are shown here in the left column, we put the results into decision boxes, and that is what's shown in the right column. So when a result is in the red range, agencies like the Water Board recommend that some action needs to occur to reduce these risks. When a result is in the yellow range, we need to determine what to do next, and that usually includes something like additional investigation or monitoring. When a result is in the green range, it means that the health risk is considered insignificant and no action needs to occur. So these risk ranges that are shown on this slide are equivalent to the risk ranges that have been identified by the United States Environmental Protection Agency, and what the US EPA refers to as the risk management range is the estimated cancer risk between 1 × 10⁻⁶ and 1 × 10⁻⁴. So that is where the yellow range comes from. I will use this color scheme throughout the presentation to represent these risk ranges. Next slide, please. Okay. So this slide presents our approach to developing the human health risk assessment. Our process is consistent with the applicable guidance from various agencies in California, and also with the technical approach memo that Wood wrote and was approved by the Water Board. As I mentioned on the risk assessment slide, the approach was developed to be protective of human health. In the risk assessment, we have presented the results in several different ways. So this means that the risk assessment has a lot of numbers in it. And we understand that this may be confusing. So to help with that, I'm just going to briefly summarize each of the types of calculations that we did. So first, as shown in the second bullet on this slide, is the evaluation of current risk. And the risks for current conditions are evaluated based specifically on indoor air measurements. So this provides information about what the conditions are at the present time in a particular residence. The main uncertainty with that evaluation is that we don't know how indoor air measurements might change over time in the future. So things that can change over time are, for example, a change in conditions in the subsurface. So the chemicals that are present in the subsurface might move around over time, or your building might change over time, and this could have some effect on the indoor air concentrations. We also assume that you live in your residence for a long time, which is the 26-year period. And so that's a long time into the future. And that's another uncertainty. So to account for this in the risk assessment, we have presented a range of future possibilities that try to account for those potential changes. We evaluated risks as they could exist in the future in 3 different ways. And these are shown in the last bullet. The future conditions risk is based on soil gas data from the subsurface. And the soil gas data are used to estimate possible future indoor air conditions. And for future risk, we evaluated every property, whether we have collected samples at that property or not. So if we had the data available, we use soil gas data from your property. And then if we didn't have those data, we use soil gas data from other properties in your building. And then if we did not have soil gas data for your building, we use data from soil gas points in the street. So the first approach for future risk evaluation is a default screening approach that is based on US EPA's nationwide database. And this is the most stringent approach. The next approach is a multi-parcel wide approach, and this is based on soil gas data collected in your neighborhood and other parts of the site. We use this approach to recommend the next steps for your neighborhood because we think it is the most appropriate and still health protective for decision making. The reasons that we think this are because this approach is based specifically on data collected in your neighborhood, and that data set is larger than the relevant data set in EPA's database. That nationwide database that was created by the US EPA really only has data from 4 houses that have a similar slab on grade foundation construction that are like yours in your neighborhood. California agencies are currently compiling data from this investigation at the Ford site and other vapor intrusion investigations in California to come up with a more applicable California specific approach for this type of evaluation. The last way that we presented the results for potential future risks was using a building specific evaluation. And that is based on data from your particular building instead of the whole neighborhood. The primary assumption here is that vapor intrusion conditions won't change significantly over time for your building. So next slide, please. All right, this slide summarizes the risks that we calculated for your neighborhood. And we know that talking about cancer itself is scary, but when we're talking about cancer risk, we're talking about the chance of getting cancer. So the point of this slide is to illustrate how the chance of other events occurring, like say getting struck by lightning or the rolling of a dice, compares to the risk results for the Belcourt Hill neighborhood. And the colors here are the same as the cancer risk decision boxes that I presented on the risk management slide. So in the United States, we have about a 1 in 3 chance of getting some form of cancer over our lifetime. And that risk would be at the top of this chart in the red and higher than the chance of rolling a 1 on a die. So for the current conditions at Belcourt Hill, using the indoor air data, we were able to evaluate 9 properties, and no homes fell into the red for the cancer risk. 2 properties are in the yellow risk management range, and 7 properties are in the green range. And the range of current risks that we calculated is shown with the arrows on the left. The future risk range is shown with the arrows on the right. And this goes from the lower end of the red range through the yellow and into the green range. So as I described in the last slide, since we can't predict the future, we evaluated a couple different scenarios for each property, and that ends up giving us a wider range of potential risks. So when we have results in the red or yellow, we can do something about that, and that is going to be the focus of Jessica's presentation. Overall, the goal of the next steps after the risk assessment is to move properties from the red and yellow into the green zone. So next slide. This is a snapshot of the current conditions results. So we have 24 homes in the investigation area. And at the point in time when we did the risk assessment, 15 of those had some indoor air data collected. And then 9 properties had at least 2 sets of seasonal indoor air data, which is what we needed to conduct the risk assessment for current conditions. And the main message here is that most of the properties that we evaluated are in the green range, and that's 7 out of 9 properties that we evaluated. So last slide. All right. So lastly, this is a summary of the future conditions risk evaluation. And the figure that is shown on this slide is figure 9 from the risk assessment report. The only thing we added to this slide that isn't shown in the report are the yellow and red circles, which give you an additional perspective because these correspond then to the risk ranges that we talked about earlier. This figure also represents the recommendations that we made based on the risk assessment. And just to give you a little bit of perspective on the figure, you can see the outlines of each property and they're labeled with a numerical ID. And so we use numbers instead of addresses, in this case, to protect the privacy of the residents. So 4 properties that we evaluated, 21 of them are in green. So that is the insignificant risk level for future risk. 3 of them are not shaded in green. And 1 of those is in the yellow risk management range, which is shown with the yellow circle. And then 2 of those have red circles, and they are in the red range because the non-cancer hazard is greater than 1. So it's not actually, it's related to non-cancer hazard and not the cancer risk. So a couple things to point out about this evaluation. These are future risk estimates based on soil gas measurements and not the indoor air that you are breathing right now. So these predictions are not set in stone, and they're just potential future scenarios that we developed and used to make recommendations. And as I said, the green shading indicates that the risks are considered to be insignificant and acceptable for future conditions. The Water Board is going to use these results for the future risk evaluation to make long-term decisions for how to manage the site in a health protective way. These decisions are going to be made on a building specific basis. So that is for each group of properties that are within a particular building. And since the Water Board is using the results of the wood risk assessment to inform their decisions, they've also had OEHHA independently review the risk results to provide their opinion. And that's what Amanda is going to discuss next. So with that, I'd just like to thank you very much for your time, and I'd be happy to take any questions.
So as a reminder, you can unmute yourself to ask a question. You can raise your hand using the Zoom function, or you can type your question into the chat function and we can read it aloud. Doesn't seem we have any questions. So I think Amanda, you're up next. Amanda, you're on mute.
Sorry, classic issue. So as John said, I'm Amanda. I work for the Office of Environmental Health Hazard Assessment, which we refer to as OEHHA, and it's part of state government. My organization routinely reviews risk assessments for sites like these. So I'm going to tell you a bit about the purpose of the review and the results for your neighborhood. Okay. So the purpose of the OEHHA review is to check whether the risk assessment is reliable for the project manager, who is Jessica in this case, to use to make decisions about the site. So part of this is ensuring that the assessment is also health protective. During the review, I usually check calculations and resulting values and explain differences. I also check that the sampling data are representative of exposure conditions and point out uncertainties, for example, if not enough samples were taken. OEHHA generally does not determine if or how risks should be addressed. The process of the OEHHA review is just about making sure the risks are accurately described. Okay. So for my review of the risk assessment for Belcourt Hill, in general, I found that Wood followed appropriate guidance and calculations were correct. There were some differences, and I will discuss 3 of these. So one difference is that I calculated cancer risk that was 3 times higher because OEHHA uses a particular factor to protect children from chemicals that cause cancer. So Wood followed guidance from the U.S. Environmental Protection Agency and other agency within California's Environmental Protection Agency on this point. This is a difference in scientific opinion between agencies, and we see this in many cases. So it is a difference that can affect outcomes, but it is not a huge difference in a risk assessment. So in your neighborhood, 2 homes that were in the green were bumped up into the bottom of the yellow in my calculations. But in the big picture, the risks were still low for the current risk and no homes were in the red for current risk. Okay. So the second difference is in the way OEHHA recommends evaluating future risk. The health risk might be different in the future if, for example, someone remodels their home or the foundation cracks, and as a result, more contaminants are able to move into the home, which in turn can increase the health risk. So the future scenario is challenging to evaluate because we don't know how events in the future will affect the health risks. Wood included 3 different calculations to estimate future risk, which is helpful to see different approaches. However, OEHHA recommended the most protective approach, which follows U.S. Environmental Protection Agency guidance. OEHHA's preferred approach resulted in estimates that were 60 times higher than Wood's 2 other approaches. Again, this is for the hypothetical future risk estimates, not what was measured inside your homes recently. I recommended the most protective of the 3 approaches in order to account for things that can increase risk in the future. And the third difference is also for future risk, and it's related to the limited number of subslab samples. So those are the samples taken just beneath the foundation of your home. There was only one location with a subslab sample per home. It would have been better to have multiple locations sampled in each home, like the indoor air samples. There were also relatively few homes that were sampled in this neighborhood. And because of that, I recommended that the water boards consider other data, specifically the soil gas samples taken in roads in the neighborhood for the future risk estimates. In other words, I'm saying to look at all of the data available for the area, not just one subset of the data. So this other data set resulted in higher estimates for future risk for some locations. And this recommendation is also typical of OEHHA reviews. We often identify uncertainties we feel are significant and recommend a more protective option. So that's all that I have. I will hand it over to Jessica now, unless there are questions for me.
So then again, if you have any questions, feel free to just unmute yourself and we can answer those. Okay, we don't have anything in the chat either, so.
Okay, if during my part of the presentation, if something comes to your mind and you come up with a question, feel free to interrupt me and ask. And I will also pause at least one spot for questions as well. All right, so before I start discussing our response, I just want to first discuss the area that the risk assessment covers, and those homes are identified on the figure below. There are soil gas monitoring points not shown. There are on this figure that are used to determine this particular area, the indoor air investigation area. And they do continue to be monitored regularly. So if your home falls in the indoor air investigation area and is offered indoor air testing, please have your home tested. And then lastly, the risk assessment will be updated in the future as more data is collected. So for the water board's response, we evaluated the risks, the results from the risk assessment that Wood prepared and the comments and results from OEHHA's review. And based on that, we considered the current risk and hazard results and the future risk and hazard results for the next steps. So first, I want to talk about the current risk and hazard results which did identify vapor intrusion may be occurring at a few properties, and I'll discuss those ranges on the next slide. And then the second conclusion is acknowledging the unknown future conditions, such as building modifications and or the degradation of a building foundation that may increase vapor intrusion in the future. As a result, future risk and hazard calculations are considered in our next steps. And I'll discuss that more in the coming slides as well. So now I just want to talk about the results, what these ranges that were calculated mean, and how it informs our next steps. So first, I want to talk about current risk and hazard ranges, which is calculated from the results of the indoor air sampling. And just a reminder, when I talk about risk, I'm referring to cancer risk, and when I talk about hazard, I'm referring to non-cancer health effects. Also, these calculations do assume you're in your home 24 hours a day, 350 days per year over a 26-year period. So the current risk and hazard ranges fall in the green to yellow areas, which means for homes that don't have exceedances in indoor air, those are in the green area and there's no immediate response action needed. For homes that fall into the yellow area, they are continuing to be monitored, and that information lets us know that longer term monitoring, additional assessment, remediation and or mitigation may be necessary down the road. And that's where the future risk calculations help us in determining the next steps. So for future risk and hazard, these ranges are calculated based on soil gas concentrations. And at the beginning of the presentation, Wood had mentioned that they calculated future risk scenarios 3 different ways. And of those different ways, the most protective scenario they calculated is the way that OEHHA calculates risk. Also, I want to mention that these future risk and hazard calculations are not guaranteed. It's an unknown right now if they will if there will be any change from the current risk calculations in the future. And that's why we want to do some longer term monitoring and also consider these future risk and hazard calculations in our next steps. So the ranges I'm going to discuss are from OEHHA's calculation based on soil gas collected from below the foundations of the home. And again, these calculations assume you are in your home 24 hours a day, 350 days out of the year over a 26-year period. So the future risk and hazard ranged using that most protective scenario ranged from green to red. Therefore, we take the results from this calculation and compare it to the current risk and hazards to assist in determining the next steps. But then there's another layer we're considering as well. So OEHHA had calculated risk from nearby soil gas probes in the street within Belcourt Hill using that most protective scenario and one based on the site-specific calculations. And it's important to compare these different calculated future risk and hazard calculations to assist us in our risk management decisions. So the future risk and hazard using that most protective scenario ranged from green to red, similar with looking at the subslab, but in this case, it would have brought in a few additional homes. The future hazard and risk using that site-specific scenario also ranged from green to red, and that was due to hazard being right at 3. So that put it right into the red. It didn't increase the hazard, or sorry, the cancer risk stayed right in the middle of yellow, but it was that hazard that bumped it into the red. And the water board takes into consideration the higher of those estimations between hazard and cancer risk. So we evaluate current risk and hazard as well as future risk and hazard calculations from data from beneath the foundation of the building, as well as those results taken, or the calculations taken from the probes that are located in the city right away, because based on what the soil gas plume is doing, meaning is it moving, is it getting bigger, smaller, this information helps us to determine the longer term next steps. So potential response actions in this case could be monitoring, additional assessment, or mitigation. And also an example of what we can do is for homes with a future risk and hazard that falls in that yellow, and we have current risk and hazard results that are in the green, we're going to want to keep monitoring that home. That would be the most appropriate path forward. For homes that have a future risk and hazard in the red and the current risks are in the yellow, we're going to want to keep monitoring the soil gas plume and the indoor air, and then also possibly look into some long-term mitigation or remediation. And the point that I really just want to make here is that the Water Board takes into consideration both current and future risk and hazard calculations to support those risk management decisions, which are the next steps. So from the risk assessment report, we identified the need to develop a feasibility study to evaluate the feasibility for potential remedial action of soil gas based on current data, as well as the need to conduct some longer-term indoor air monitoring. As a result, the next steps included the submittals of two different reports, a feasibility study, which was submitted on November 19th, and an indoor air monitoring plan, which was submitted on October 14th. So first, I want to talk about the feasibility study. And I want to point out that this is to evaluate soil gas remediation only. Groundwater is still being assessed in the area, so the need for groundwater remediation will be determined and evaluated at a later date. So the feasibility study is a comprehensive report that includes three main items. First, it proposes remedial action objectives, which are the goals of the remediation efforts. Remedial action objectives need to be protective of public health, and they also need to be technically feasible to be implemented in the field. The second is the feasibility study itself. This portion of the report looks at all of the remedial options and evaluates the feasibility of implementing them to achieve the remedial action objectives. And the main component of the feasibility study takes into consideration the ability to implement the technology, the effectiveness of the technology, and cost. Other factors also include acceptance by the regulatory agency, as well as acceptance by the public. And then the third component of this report will be to develop potential remedial alternatives, and based on the feasibility study and the remedial action objectives, recommend one of those. Then there's the indoor air monitoring plan. So this is a longer-term plan to evaluate indoor air to verify if vapor intrusion changes over time. And this is where we would take into consideration that parcel-wide attenuation factor calculation that Wood developed. There's been a lot of data collected just throughout this project from a number of communities, and this would be an appropriate way to utilize it. This longer-term monitoring plan will provide analytical data to support whether the current risk and hazard calculations are still appropriate or not. The monitoring frequency will be based on soil gas concentrations and trends, and the frequency of sampling can range from every 6 months to once every 5 years. And Ford will be sending out letters at a later date to notify you of which sampling frequency category you fall into. So that kind of sums up the risk assessment and our response in those next steps in the little bit more of the short term. Are there any questions before I start talking about the soil vapor extraction pilot tests? And if something pops up, we're going to have time for Q&A at the end of this as well.
You can always type your questions in the chat function too.
Okay, so I'll start talking about soil vapor extraction pilot test, and John, if something comes up, just interrupt me and we can go back to the risk assessment.
Sure
So
thing.
the pilot tests were conducted at 3 locations. The Bonita Creek area, which was adjacent to the Newport North apartments. It's north of Belcourt Hill. There was one conducted at the Bay Ridge Park community, and one right across the street at the Sea Island community. And we're going to discuss the one that occurred at the Sea Island community, since it's located right across the street, and the data from that pilot test location would be used in the feasibility study. So before I talk about the pilot test results, I just want to first provide a refresher about soil vapor extraction, which is also referred to as SVE. This figure is just an example of how this type of remediation works. SVE is a remedial technology that can remove vapors from soil above groundwater, and that area is referred to as the vadozone and is labeled on that figure there. So contamination within the vadozone is removed in the form of vapors through extraction wells, and the vapors are treated above ground, and those cleaned treated vapors are then released to the atmosphere. So another little refresher, this inlay just shows soil particles and how vapors can reside in between the spaces of the soil, and those vapors are what's being extracted. So the pilot test was conducted at the 3 locations that I mentioned, and due to the close proximity of Sea Island and the similar conditions below the ground, that's the one I'm going to talk about in this presentation. So the pilot test consisted of 1 extraction well. It ran for a total of 5 days, and it did operate for about 8 to 10 hours per day during daytime hours. And during the pilot test, nearby soil gas probes were monitored to evaluate 2 main things. First, vacuum pressure to see if and how much effect the extraction well was having. And second, soil vapor data was collected from the extraction well and nearby soil gas probes before and after the pilot test. And the data that was collected was used to evaluate the radius of influence, which is shown with this green elliptical, which is just how far does the vacuum from that extraction well reach, both laterally and vertically, and then how much contamination is being removed. So first, want to talk about radius of influence. And again, that's how far the vacuum effect on the extraction well reaches. So the industry standard radius of influence for a typical site that would consider soil vapor extraction satisfactory would be a range of 20 to 50 feet. For this nearby one at Sea Island, the radius of influence was 64 feet, and those results indicate a good radius of influence for the area. Total mass removed, and again, that's how much contamination was removed from below the ground. Industry standards for a typical site suggest that mass removal of 1 pound per day or greater at the start of soil vapor extraction is satisfactory. During the pilot test, a total of 0.03 pounds total was removed in the 6 days, which was a total of 52 hours of operation. And those that low mass removal is consistent with the low VOC concentrations that have been detected below the ground at this area. So the results of the pilot test will be used in the feasibility study when evaluating the best remedial approach for the site. And as I mentioned a few slides ago, the feasibility study takes into consideration the ability to implement the technology, the effectiveness of the technology, and cost, as well as acceptance by the regulatory agency and acceptance by the public. So for those of you that were at the public meeting a couple years ago in November 2019, you may remember my analogy of the effectiveness of soil vapor extraction based on soil type by comparing it to a milkshake versus a slushy. So the milkshake represents a tighter, fine-grained soil like clay, which makes air movement more difficult and limited. And the slushy represents soil type that's more permeable, where air flows easier like sand. The radius of influence results indicate slushy. The type of soil below the ground was favorable based on that metric. But the mass removal results indicate that almost finished slushy. You suck on the straw, but you don't get much from it. So in that regard, soil vapor extraction may not be as feasible and as favorable. And these considerations, along with the results from the risk assessment, are important in that feasibility study when determining remedial approach for the site. So to summarize, the risk assessment results support the risk management decisions The feasibility study was submitted to the Water Board on November 19th. And that pilot test results are used in the remedy evaluation. Our response is pending for the feasibility study, and once our review is complete, we will host a meeting with you to discuss the feasibility study and our comments. For more information, you can go to GeoTracker, which is the state's database for the site that has all of the reports, analytical data, and additional information. There is the LIRIS list, which you can sign up for. It's an email notification list that we send emails out for when the next large community meetings are. There's a Water Board webpage as well that has information about this site on it. Then Ford has their site-specific website as well as their information number that is in both the chat, and it was at the beginning of this presentation. And then there's the local information repository at the local library. So that concludes my part of the presentation, or the presentation as a whole, and we have time for questions.
So please feel free to, you can either unmute yourself, you can write your question in the chat box and we can read it aloud. If you have any questions, we welcome them.
And I know that was a lot of information, and maybe as you know, some time passes and you're thinking about this, or if you go back and rewatch it and you come up with some questions later, feel free to reach out to us, whether it's my phone number or that information hotline number, if to call and ask any questions, or email us as well.
And Sarah just put all those resources back in the chat for everyone again. All right, I'm seeing some thumbs up from Tom at least. Okay, I do have a question that just came through the chat. It says, is there anything as homeowners that we can do independently to mitigate future risk? For example, air filters?
So when it comes to air filters, if there is vapor intrusion inside and there's VOCs, then it needs to be a particular air filter that that has carbon to pull the VOCs out. One of the big recommendations that we've been giving all along is just increasing your airflow in your home by opening your windows during the day, and just allow that air circulation, air turnover from within the home. That helps improve air quality. And there is a link to the, I believe it's the California Air Resources Board, that has a kind of fact sheet about reducing VOC concentrations in indoor air, and that's one of their big recommendations. But we have that link, or that handout, both on GeoTracker as well as the Ford's website.
Follow-up question, what are some brands of filters that you were referring to? What do we look for?
Oh, off the top of my head, I don't know. I am not sure.
I think you want to look for activated carbon in the air purifier.
I can find one. Sylvain makes a product. It's called the Air Pura. Hold on. These are the ones where if a property exceeds long-term screening levels, we offer air purifiers. We haven't offered air purifiers to this particular parcel.
But is the question asking more on like the for your HVAC system? You know how you've got those filters that you put in when it's running through the house, or is it a standalone? Or is it a standalone air purifier? If the person who asked the question wants to clarify.
Feel free to unmute yourself and we can, oh, she said, or they said standalone.
Okay. I will see if I can add I've got a Mike, do you have the PDF of that one?
I do somewhere.
I
I'm
have
just
it on
trying
my
to see if I
desktop.
can find the
Yeah,
air
Mike,
pure.
there's, I'm just trying to look for our letter, you know.
Our particular model. Yeah, I'm
we're
on the
looking for
Sylvain one.
PDF. Oh, okay.
I have here. Let's
There it
see.
is.
There we go. I just put it in the chat.
Okay.
That should be the one that you guys have, or that
Mhm.
if I recall, is the one you guys are using in the homes right now that have vapor intrusion occurring.
Yeah, Air Pura C600.
Yep, that's it.
Yep. So yeah, activated carbon bed and a HEPA filter.
Correct.
So yep, those are the aspects that it has. Yep.
There's also a website from the Air Board, because air cleaners are supposed to be certified by the Air Resources Board. So I can put that website in the chat as well.
Great, thanks everyone. Are there any other questions or follow-ups? Thank you, Russell, for your comment. He says, thank you. Well done overview.
Thank you.
Well, if there aren't any other questions, as we mentioned earlier, you can always reach out to Jessica Law. Her phone number and email are in the chat earlier. You can also call Ford's information line, and we're happy to put you in touch with the right person. And just want to say thank you to everyone for your time this evening.
Yeah, thank you. Thank you all for joining.
Have a great night, everyone.
Bye.
Bye.
Bye-bye.